Good morning, good afternoon, and good evening, wherever you may be. Welcome to Bridging the Healthcare Gap. Now, today I'm absolutely delighted to be talking with Drukmo Gyal. Now, tell me your surname again. We practiced it beforehand, but I didn't quite get it right. Drukmo Gyal.
Yeah, that's perfect.
Drukmo Gyal. And I'm going to explain to you a little bit about, what Drukmo has to offer us. Because Drukmo has come over from Tibet not that long ago, but probably in about 2013, is that correct?
That's correct.
Yeah, so 2013 she travelled from Tibet and is now living in Estonia in Eastern Europe. So Drukmo shared a little bit about her, and this is on her own website. So Drukmo Gyal was born into a family of Nigapas, is that correct?
Ngapa, yes.
Nyakpa. We went through all the pronunciation beforehand, but I knew I'd need her help. And that Nagpa are mantric Tantra ritual practitioners. And Drukmo grew up in a multi-ethnic community in Rubgong in the Amdo region of Tibet, where mantra and meditation were an integral part of her daily life from a very young age. And under the positive influence of Dr. Nida, Drukmo Gyal studied traditional Tibetan medicine in Amdo before working for Sori Khan Estonia and studying under Dr. Nida Chenatsang, a traditional Tibetan physician and lineage holder of the
Yutok
Yutok,
Nintik.
Yutok Nitik, the unique spiritual healing tradition of Tibetan medicine. And in 2016, Drukmo gave a TED Talk, and she explained the power and positivity of the feminine and the importance of women within the Tibetan Buddhist tradition. And in that talk, she talks about Tara, the Tibetan divine version of the divine feminine, and that in her culture, every mother is seen as Tara by her own child and the strong bond that is held between them, and a bond that is disrupted in so much of Western culture today. And drawing from sacred sounds of mantras and prayers within the Tibetan tradition, Drukmo combines her heavenly voice and her understanding of Tibetan medicine to create a healing concert for body, speech and mind. She's curated 5 albums of Tibetan healing mantras and prayers with musicians from around the world and has travelled to more than 30 countries for her concerts, lectures and courses. So welcome, Drukmo. There's so much that we can talk about.
Thank you. Thank you, Claire, for including me in this
Of
panel.
course, of course. So to start off, Drukmo, I'd love, I've introduced you with your bio, and I'd love for you to present yourself to the audience and to say a little bit about you and about, your roots in Tibet and how you came to Estonia in Eastern Europe. And when you first knew that you had this mission to come to the West and share some of Tibetan medicine.
Thank you for the questions. That was a long list.
Oh, sorry, so a
And
little bit about you, about growing up, and I know I'm sure we could take days, and we said we only have an hour, but yeah, just a couple of little kind of who are you, and why are you here, and what do you love?
Basically, everyone, as you have heard a written description of me, very official, but unofficially, I'm a young woman from Tibet, grown up in quite traditional settings, environment, traditional in a sense that we share strong religious and religious morality, and the morality and ethics are shared in the community, and the connections between people are strong. So there is a very strong community, a sense of community. Which I think in the West is a bit fading away or outside of the highlight. But at the same time, I see that people are aware of the importance of community, and they're creating and recreating different kinds of community. So Tibetan medicine and also the spiritual healing methods have become attractive to people who are looking for communities.
And at what age did you decide, or did you know that you would be coming? You'd be traveling over to the West?
Uh, in fact, I have always had a wish to travel. I think it's not a unique wish, because all the kids, after watching different Hollywood movies, think about outside of the world, especially outside of their kokon, little villages and valleys. But I was pretty clear that my main interest was always with spirituality. And when I hit my early 20s, then this need of spirituality led me towards medicine, also thanks to Dr. Nida's inspiration, that I understood spirituality is an important element of healing, of medicine.
And it's not just all about the body. And I always say the Western medicine, that we pay a lot of attention to the body, and we've made remarkable achievements with the body, but without the spirit and the mind as well, that healing, true healing can't occur. And I was also just so enthralled with your presentation, with your TEDx talk, and really how you present the place of women within Tibetan culture, and women women within the community. And there's just such a lovely lightness about what you bring, and bringing that the beauty of your voice to healing is really, really lovely. And even today you were doing a recording of one of your, I assume it was a mantra that you were recording this morning, or yes, so. And we'll refer to it later on, but Drukmo has very kindly offered us a free gift to the audience as some of her music. So, and yeah, so you obviously realised that you became interested in healing and in spirituality, and seeing how these could, and that's what we're saying, is about bridging the gap and seeing how you could combine these. And could you explain a little bit about how you combine these? What types of sound you use, and actually the title of this talk is the use of mantra within Tibetan medicine. So could you perhaps explain what mantra is? And I'm aware that you've got a presentation, so you may want to start that at any point, whatever is suitable for you.
Thank you. I'll be sharing the screen.
All right. Great.
As you can see, the topic for today is about mantra, but in order to understand mantra from a healing aspect, I have to start with Tibetan medicine and its relation to mantras. So many of you might have seen or heard of Medicine Buddha, and this is a beautiful tanka of Medicine Buddha's mandala, or we also say the Pure Land farm. Because it's full of plants in 4 directions. And these different directions actually grow different types of herbs. In the south, where there are more sun, the herbs are more hot-natured. So they are good at healing cold-nature diseases. Whereas on the north side, more moon energy, then the herbs are also containing more cooling effect that are antidotes to hot-natured diseases. So by understanding that structure, you can already see that nature plays an important role, how Tibetan medicine think of health and sickness. if we go through nature, then we can't escape the elements such as earth, water, fire, and wind. Of course, space is the mother element. Without space, the other 4 elements wouldn't even exist. And you can see in the subtitles in each category that there are connections that each element shares with our physical body. For example, the earth element, if we think about the characteristic of earth, it's heavy, it has a weight to it, and it's also stable, it's grounding, and it has this density. And these elements, these characteristic of the element manifest in our body. Therefore, they're connected with our stomach, spleen, bone joint, and also if we experience too much earth element in the body, then problems that we can possibly suffer from are stomach disorders, joint disorders, and obesity. So I won't go to other elements now, but if you're interested, there are other talks you can dive into.
It's fascinating, so thank you.
And those 5 elements are the base of how we understand our bodily existence. And oftentimes in different Tibetan medical books, we refer to 5 elements or 4 elements, because space sometimes are left out in the theory, because without space there won't be other elements, so they don't talk about it. But even to come down from the 4 elements, we speak about 3 energies, or the medical term would be 3 humors. This is quite common in both Tibetan medicine and Ayurveda. You will see the same structure of understanding these elements. And these 3...
Actually, Drukmo, what I realise is very similar to what was practiced in Europe as well. We talked about the humours, whether they were choleric, what their basic temperaments were. And it's, it is amazing. We say, oh, this is all, yes, we're learning a lot of wisdom from the Eastern traditions, from India and China and Tibet, yet it's within us anyway. So sorry for interrupting.
Thank you, Claire, for reminding me. It also has similar root in Greek medicine. In Greek medicine, they have 4 humors, and Tibetan medicine sometimes also speak of 4 humors. And the 4th one, which is not listed here, is blood. So too hot and too cold by nature. So for example, the lung, the wind, and the phlegm are cold, and tripa, the bile, and blood are hot. So if we speak about nature and nature of diseases, then we would categorize the 4 humors in such way. Thank you for reminding. And in order to have a healthy state of mind and body, then we have to keep a harmonious proportion of these 5 elements or 3 energies, or the most famous term in the West, yin yang, hot and cold. As you can see, this is a painting of tree and little people on each leaf. It's an important illustration or a way how Tibetan medicine is presented. There are many tankas or like tanka paintings like this to teach and train Tibetans in medical knowledge. So we believe that our bodies are same like trees. So if we understand how everything in nature is in balance or imbalance, that understanding, that observation can directly apply onto our own bodies. We believe that the primary causes of disease are the 3 poisons. This has a very strong relation with Tibetan Buddhism. It's gaining popularity in the West since 1960s because it has this psychological aspect. So psychological health explanations are included from the understanding of sickness. So the 3 poisons are briefly desire, attachment. This is the first group. And second group is anger, hatred. And third group is confusion or ignorance. Ignorance not meaning that you don't know, but you ignore. So three poisons, we call them. But it doesn't mean that we want to eliminate them. Especially in the medical tradition, we're not looking to eliminate them. We're rather looking to balance them. We have to have them, but in a controlled amount and with awareness. And the secondary cause are the 3 energies. So the 3 energies that we talked earlier. These 3 energies can be influenced by seasonal changes, diet, lifestyle, and Tibetan medicine also talks about an important category called Don spirits. So we believe in the non-human existences, and often these non-human existences are in the nature. They reside in the nature, and if we break our balance with the nature, then these Don spirits can come to attack us in the form of different diseases. So that's also very interesting because Tibetan medicine do not put human in the center. It's not anthropocentric. It is very ecological. It concerns a lot the relation between human and nature. Nature, in a sense, outside water, earth, mountains, yeah. And then, yes.
Talk about the interdependence there as well of us,
Yes.
and how we are, all connected. So.
Yes. So the interdependence is reflected in all aspects. Interdependence between body, mind, interdependence of our existence and the nature. So very holistic approach. And not fixated to any point, but rather to have a broad space. And then whenever needed, we are always with awareness and flexibility to go to the point to deal with the problem.
I think that's a big difference between that and Western medicine, because we seem to be very focused on the one thing that's wrong and forget about, the not saying we forget about, but the quality of life or all the other aspects. And I think, as well as you say, it's many different points, but it's also the relationship between them.
Yes. So if I go on from there, then we have 5 healing methods. Tibetan medicine offers these 5 healing methods. That's where also Tibetan healing mantra belongs to. So we have diet, lifestyle, herbal medication. 70% of the medications are herbal based, and not in large quantity because they have all been growing in different high mountains. organically. But in recent 20 to 30 years, two, three decades, there has been more industrialized planting of herbal medicines to kind of maintain the market, to maintain the market. But Tibetan patients are also, not only patients, but doctors are also complaining that the effect is decreasing. So I think that also gives us more that we should take that into our account. If we want to keep good quality herbal medicine, then the consumption part should be controlled. It should not be just out of desire, but out of need. And the fourth one is external therapies. Tibetan medicine has massage, moxibustion, acupuncture, Chinese medicine. But Tibetan medicine also has unique therapies such as herbal bath called lum and horme therapy. It's a special therapy with herbs and hot oil. Very good for menopause and anxiety, insomnia. My personal training of horme therapy in Amdo Tibetan Hospital, there are 2 female doctors, and when they started out the department, it was only one big room of maybe 60 square meters, and now they have almost half of the building with 100 bed inpatient beds, wards, because it was so, horme therapy was so effective for female for gynecological diseases, and they were able to expand the department within 10 years. Pretty proud of that.
Amazing. Yeah.
And the fifth one is called spiritual healing, and we have 3 doors to realize this spiritual healing: body, speech, and mind. Now I think you can probably sort out many information that you have consumed online about mindfulness, meditation. So these are all belonging to the mind category. And there are many yogas from Hindu tradition, Tibetan tradition, and other traditions. Those are from body category, the spiritual healing through body. And mantra is healing through speech, through the replacement of what we use our voice, or with what we use our voice. We will go.
It sounds that the mantra then actually combines the mind and the body,
Yes.
it is the bridge.
Yes, it is the bridge. And we also believe that, especially in the public knowledge, whenever we think about mantra, the most famous understanding is this Indian kirtan. So it's always chanting with melody. But in fact, in mantra healing, sound or the production, the producing sound is not the only aspect of mantra healing. Silence is the best mantra. Breathing is the best mantra. And then sound of syllables, producing the syllables. And oftentimes why people find singing the syllables more effective is because the singing of syllables can hook back your scattered consciousness. That's why oftentimes we start chanting out loud, and then slowly when the consciousness, scattered consciousness are hooked back in the present moment, that your mind and your body are unified through the power of speech, especially chanting the syllables, then you go to silence. You go to breathing. So this is the full aspect of mantra healing. If I may, let's go through each one of the doors. Let's taste them in today's session. So the first one is a famous self-healing yoga called Nejang. In the ancient time, doctors prescribed these exercises for patients. Ne means location. Jiang means purify. So it's purification of different locations in our body. Medically speaking, it's to unblock the blood circulation in these places. But in like spiritually speaking, then it also unblocks the energy in that area. For example, we're going to do the lip exercise. Lips are the flowers, because flower we can see outside, yeah? Flowers of stomach and spleen. So it's very common that Tibetan doctors are trained to observe the patient's lips to understand the condition of stomach and spleen.
Well, that's interesting, because I've heard a lot about the looking at the tongue and analysing the pulse, but not actually the lips.
Yes. And you can actually see that if you haven't been eating well, and if you haven't been having like irregular eating and drinking habits, then your lips will lose its shine, and it will crack, it will dry. So that's already signs for you to know that you're not taking care of your stomach and spleen.
And in energy medicine, stomach and spleen are very much about the way that we take care of ourselves. Yeah.
Yes. So what we do is the exercise is to open your mouth as big as possible and close as tight as possible, and do as many as possible in one breath retention. So we will be breathing in, and when we breathe in, our chests are full of the air, but you should try to push down the air to the lower belly, and then start the exercise during the retention. And when you're done, you feel like, okay, this is how much I can hold the breath, then you can release. Okay, let's do it together.
Okay.
Inhale.
I was just holding my breath there. So
Yes.
let's inhale. Yeah.
Let's do it together. Inhale.
Mm-hmm.
Okay, exhale. Very good.
That once more, because I think maybe perhaps people saw me doing that. So I'm going to stay quiet this time and see if we do it once more.
Yes, wonderful. This time, I would suggest you not only to stop breathing, but also pull up your anus. So it's kind of like visualize you have a bamboo tube in the center of your body, and you close both ends. So you kind of close here. You also close in the base. In your genital organ area. You close up you're pulling it upwards, and then we will do the exercise. Okay. Inhale. Let's not rest. Let's have one more time. Inhale. Very good.
That's really interesting because I know that we talk about the different orifices of the body, but we tend to be so focused on, our mouth. And when you were saying about closing the anus, of course, that then brings our attention to that area in the body. And when I was doing that, I was incredibly aware of it, and it felt that as I opened and closed my mouth, I felt the movement of the muscle there. I couldn't keep it closed as you told me to. So
Yes. Um, that's a very good observation, and that's also how we hook back our lost or scattered consciousness. And the other thing is when you do this exercise nonstop for a couple of breaths, let's say 5 to 10 without break, you will feel very hot in the thyroid area as well. So my teacher, Dr. Nida, also suggested that this is very good for thyroid problems. It stimulates the blood circulation in this area. So as you can see, it's written there, the tantric benefits, that refers to the spiritual benefits, and the medical benefits. Very similar. Some can be very similar, some can be different, because the medical anatomy and the Vajra anatomy are slightly different, focused.
And could you explain to us in simple terms about what you're saying about the tantric benefits? Because I think the word tantra has been so misunderstood in the West, and people tend to think that's just a little bit kinky, which is absolutely not. It's about actually harnessing that power that we have for higher means. But I'm sure you'll be able to explain it better.
Thank you for the question. So we have two tras here, mantra and tantra. But basically, simple terms, man is mind, tra is protection, mantra, mind protection. Tan is body, tra, protection. Tantra is body protection. So that's the basic understanding. Of course, in the West, Tantra has been associating with sexuality. Sexuality is also with body, and that became a hit to become famous in the West, because it's my personal thinking. It may not be a general understanding from Tibetan perspective, but I think why it became so famous, because sexuality in the religious traditions in the West are always a taboo. It's pretty much suppressed and not being talked about. But in the Eastern traditions, then it always had a place, even though in the everyday life people are shy, and it's like, people are shy, and there's a lot of biopolitics that you have to monitor people. But there has always been a place for sexuality to exist in the spiritual sense. I think that's why it became a boom.
Yeah, and I think that's really interesting because and that applies to medicine, because if something is suppressed in one area of your life, it's going to, or one area of the body, it's going to come out somewhere else.
Yes. So sexuality, being the most famous aspect of Tantra, became everybody's understanding of the whole of Tantra. But Tantra, as a like a holistic understanding, it's about body protection. And the second exercise, I personally very much enjoy, especially when we experience emotional blockage and having a heavy chest. Yeah, then we can release the heavy chest in pretty fast speed with this exercise.
That sounds very relevant to what we're going through just now. A lot of people
Yes.
have fear and anxiety about what's happening. I would say grief as well. There's been a lot of loss, a lot of change, and a lot of the symptoms of it have been in the chest. So, yeah, thank you very much.
Thank you. So this exercise doesn't look very elegant. I mean, anyway, these exercises do not look elegant, but they are very effective. Basically, you need to stick out your tongue, stick out your tongue in the middle, like straight out, and try not to touch your lips. And then you will shift to the sides 3 times, and up, down 3 times, and breathe out. Okay, so that's the first step. It has 2 steps. Wonderful. Let's do it with closing the breath and closing the anus. Okay, inhale. Very good. So that's the first step. Second step, the same thing, but after you stick out your tongue, you have to make turns, make rounds. So 3 rounds clockwise, anti-clockwise 3 times, and then breathe out. Inhale. Wonderful. Now let's try to do one more time, both steps, step 1 and step 2, without breaking between.
Okay.
Inhale. Inhale. Very good. The more you do it, the more you will feel it's very hard to keep stretching the tongue out. When you stick the tongue out, you actually the muscle, the muscle of the root of the tongue becomes stiffen. And that's a good sign, because it's exercising your heart. So your heart is having discoteca.
I remember when I was in my training, I was teaching them in the ultrasound department how to do, I just learnt the lion's breath in yoga, and doing the whole squat and everything, and I think they thought I was a little bit mad.
Yes, so this exercise, for example, if you see the tantric benefit, the spiritual benefit is good for brain disorders, because in spiritual understanding, when we talk about mind, then it's the location is not brain. The location is actually heart. And also, when we say mind, in Tibetan, we don't actually have a word for mind. The Tibetan term is called sem. Sem is not mind, not brain, not heart, but the connection they share.
So is it more consciousness?
It's a more consciousness, yes. Mm-hmm. So oftentimes the focus either goes to heart or goes to brain, but in fact it's the disorder of brain can be caused by the imbalanced connection they share. So by nourishing the consciousness, by hooking back the consciousness, it helps to balance both brain, heart. And as you can see, medical benefited disorders of heart and like tongue. Tongue is the flower of heart and small intestine.
Now, this is probably not, you probably won't be able to answer this, but these two exercises, although they felt a little bit unfamiliar, they are incredibly simple. And what you're giving is huge, big health benefits. Yet, I find, and especially I'm talking about myself as well, but it's sometimes when we offer simple things to people, there's a resistance to practicing them. And still say, well, but I want just to be fixed, or I want a medication for this. And as you mentioned earlier on about actually taking the herbs and being aware that are they produced in the proper way and only taking them when we need them. Yet there is almost a kind of a need for us to receive something external than to accept that actually we've got the power to do something as simple as that can help us. But
yeah, because
that's a question.
Yeah, but that's a very good question. Thank you. That's exactly what we spoke earlier. That in Western, in Western understanding of health, has always been focusing on the disease or focusing on the problem, and then forgetting the holistic approach to the problem, and also the understand of the problem is very fixated that you exclude everything else. It also biomedicine, if we think about chemical medicine, if we think about chemicals are natural. Chemicals are absolutely from nature, and they're absolutely organic. But what is not organic is the proportion of how they're made into one and then given in a very intensive period of time and for intensive causes. And that is artificial, let's say. And I think it's very dangerous when natural medicine lovers completely reject biomedicine by understanding that they are chemical. Even the word chemical carries like it's not organic. It is organic. And why I go there is because, as you said, these healing methods are so simple, everybody can do at home, but then it's not convincing, because it's not convincing because our own ways of understanding healing is so limited. What is good health and what is disease is limited. That's where our healing procedure is limited. Even healing needs holistic approach. We need to work, like Tibetan medicine doesn't say that you can only do this yoga and then you can heal. That's never the kind of main idea that Tibetan medicine or natural medicine speak about. They speak about holistic view. It means this will assist all your other ongoing therapies.
Yeah.
Mm-hmm. Yeah. So cannot only look one solution. Have to kind of design your own mandala, design your own toolkit. You need to have all the aspects for your diet, for your lifestyle. Yeah. And this is part of lifestyle. And for your medication, for your external therapies. So it's a holistic. Mm-hmm. So now that's for the yoga part. I will go to the mantra part. So I have typed here ancient psychologist because we don't have a separate profession called psychologist. I think we didn't have in any culture until recent decades, but we always had psychologists. They are just together with medicine or healers. It was medicine and spirituality was not separated. And mantra is a part of that unseparable aspect of healing. We have two types of mantra, spiritual mantra. So especially for those who practice Buddhism, Hinduism, then they will understand this culture more. They will feel this more relevant. And healing mantra, then there are mantras specifically for diseases and for parts of our organs, like heart has heart mantra, like lungs mantra.
In a very basic way, then, that we don't need to, my understanding is that we don't need to be part of that spiritual tradition then to benefit from the healing mantra?
I go back in my slide. It's a very good question. This is Medicine Buddha's mandala. It has 4 groups in 4 directions, 4 groups of people. And here are the explanations. Buddhist group, non-Buddhist group. Changsong means doctors or very wise people. And Dewa group. Dewa are the deities, deity group. So it's not for only Buddhists. And this has been from the beginning because medicine cannot stay in one religion. It's about human life. It's about body. It's not about religion. It's just Tibetan medicine shares a lot of psychological aspect, shares a lot of basic understanding from Tibetan medicine. But medicine tradition in Tibet does not confine it to Tibetan Buddhism. Yeah, so that's why we have spiritual mantra. We also have healing mantra. Yeah. As you earlier spotted out, that the bridge between a body and mind are our speech, energy, or like mantra here. Yeah. So if we want to keep that balance, then we have to work with our energy. And essentially, energy is about speed, slow or fast, hot or cold, light or heavy. These are energy. It's very concrete if we think. And if we think about these are actually very, very scientific. In all the scientific fields, they actually work with these characteristics of matter, of things. But then some things are manifesting non-existently. So you have to observe. And I will share 2 mantras, one spiritual mantra, one healing mantra. So spiritual mantra, one of the most famous one is Om Mani Padme Hum. And the longer version have one extra syllable at the ending, Om Mani Padme Hum Shi. So this mantra is mantra of compassion. So in Tibet, we often do it when people are sick, dying, or after death. We do this practice. We believe that this practice can help the deceased one to have better rebirth. We believe in reincarnation, yeah. And also the sick one can regain health. But always, we don't do only rituals. We Medicine Buddha and the emanation of Medicine Buddha, Yuto Yuanden Gombo in the 8th century, he said clearly, first try, when you have a problem, first try diet, lifestyle. If diet, lifestyle doesn't work, then you go to medicine and external therapies. If medicine and external therapy doesn't work, it's undiagnosable, then you go to spiritual healing. There is a step. Yeah, you can't go directly to spiritual healing. Mm-hmm. So this mantra in spiritual sense also it's increases our compassion and love, and purifies negative thoughts. Enjoy. I will sing a old melody from Tibet. And if you feel like you can also sing along the video when you're watching this.
I'll make sure I put myself on mute.
Mani Peme Honshi Om Mani Peme Om Mani Peme Honshi Om Mani Peme Honshi. We visualize a light in our heart, and this light represents our ability to love, ability to connect. Om is a union of all mantra power. Mani and Peme represents compassion and wisdom. Hong means to the union of the two and the blessings.
That's beautiful. It just brings when you were saying earlier on about having a scattered mind and being very distracted, it's just, it really does just purify things. So beautiful.
Thank you. The next mantra is mantra of the heart, the organ heart. So a lot of heart problems and depression, and it has a lot of ah sound. Ah, zita, sukha, sam. And the reason why it has a lot of ah sound is because ah is the retention of our breath. When we inhale, we have a very hidden syllable of om. And then when we retention, there's a hidden sound of ah. And then when we exhale, we have the hidden sound of hong. So om, ah, hong is the king of mantra. It's also the full cycle of breathing process. But in everyday life, we only breathe and we only do two procedures. We only breathe in, breathe out. We skip the middle part.
In between, the bridge.
The bridge. And this skipping of this bridge, skipping of this middle part will shorten our tranquility, our ability to calm down. That's also why many exercises that request the practitioner to have this retention of breath benefit from tranquility of mind and longevity, such as calligraphy. Because when you're writing calligraphy, especially in Chinese and Asian tradition, the pen, the pen has these very fragile feathers, or these not feathers, sorry, the horse tail, or what do you call those? Like pencil, pen, the calligraphy, Chinese calligraphy pen.
We talk about a pen, a nib. Well, they've got nibs and ink.
Yeah, with the ink. Yeah, so when you do that, if you want to have a good calligraphy, you can't breathe. You have to breathe in, and then holding the breath and do your calligraphy. Once it's done, you breathe out.
Ah.
Yeah, so this practice, actually, in Chinese tradition, they say this practice promotes longevity, but also it promotes tranquility of mind.
So when you are doing the mantra, you would be writing it at the same time, or you would be writing it then?
Yeah, so mantra practice, when you're chanting the mantra, you're actually making retention. You're not breathing, you know. So that's also practice of Ah. And Ah is the mother of all sound. Yeah. So, and practice of mantra healing includes chanting, visualization of how the syllables look like, and as well as writing. Yeah. So this mantra has, you can chant it. You can also create your own melody to sing it. Yeah, and the melody is not like very confined. You can have your own creativity there. So I created a very soft melody for it. I hope you enjoy. Now you can focus on the heart and transform the heart into a beautiful light of any color you like. And this light is coming from the nature, the forest near you, the rivers near you, the mountains, the fire. And from these nature, the elements are coming to you and blessing your heart. Sita Sukha Sam Sita Sukha Sam Sita Sukha Sam Sita Sukha Sam. Sita is heart. Sukha means blissful. Sam, to reside in that blissful state.
I'm just imagining singing that in the shower, how different that is to some of the other things that, well, it's so lovely when people sing in the shower anyway, but yeah, really sets you up for a beautiful day.
Thank you. And also it starts with our way of thinking, to reconnect with nature. Because sometimes we understand that going to nature is important, but we're lazy, we're busy, and we're this, we're that. And mainly because we are not even training the importance of nature in our visualization, in our imagination. So this visualization of invoking the nature elements as light and blessing our organs is a very major method in mantra healing. Yeah. Thank you. The last step, I won't go into details, but this is what we mentioned earlier in my bio, that Yutong Nintik is an important spiritual healing. Sorry, the Tibetan is written wrong here, but I will fix later. Should be Nintik. And heart of Ning means heart. Tik is essence. So essential heart teaching of Yutok. And Yutok is the name of father of Tibetan medicine. Yeah. So mind training for healing oneself. Healing really starts with your own consciousness. And I remember something very important, is that oftentimes when I was younger, in my early 20s, I was translating for doctors in Tibet, for non-Tibetan speaking patients. And some patients with very chronic situations come back to the doctor and complain, oh, it's not improving, it's not improving. And then doctor asks, but is it getting worse? And then the patient says, no, it's not getting worse. It's same like before. Then it's improvement. Because as you get older, all your organs, everything is just losing function. If you can remain the same level, it's healing.
Oh, so important. So important.
Yeah. Because everybody is so progressive, the understanding of improvement is like only getting higher, but remaining is such important aspect of getting healed, you know.
Yeah.
So it should include, it should be included in our understanding of healing. And I will briefly show a tree. As you know, that tree is an important illustration of Tibetan medicine, as well as the spiritual healing, the spiritual mind training program, let's say. So this is like a whole program. And if you are interested, there is a separate video of almost an hour on YouTube, and you can watch it later, but I won't take time now. And thank you so much. Thank you so much.
Thank you so much. That was really, really wonderful. And I can understand why you said that normally you would talk for much longer. And all the questions I was asking you earlier on could have taken several hours for you to answer. Because we sometimes just want that quick answer, and it's things need to be explored. So thank you so much. I love the use of the trees and the connection to the sky, the spirituality, and to the earth, connecting us to what's already there, and to our natural resources. So it's all around us. So thank you so much.
Thank you.
And it was just amazing for us to, we think in the West we've made so many developments, but then hearing the hormone that you've got, 100 beds in a hospital, because it's so successful.
Yes.
So there's a lot we can learn. There's a lot that we could, we've made many development, huge big technological advances. But I think sometimes there are some of these really simple things, and you shared, a couple of exercises and these two beautiful mantras today. So really, there's not much else I can, I think it's just, I felt very touched by what you shared. So
thank you so much. If I could add one thing at the ending, is that our common friend Wani wrote me last night, oh, please make sure to touch the topic that like explain that both Tibetan medicine and Western biomedicine are actually offered in the same hospital in Tibet. Because for me, it's just part of my life. We grew up in place where natural medicine and Western biomedicine are offered in the same hospital, but I understood that is not something is common in the Western countries. So I would like to say that the hospital, for example, in Amdo, Tibet, known as Xining Qinghai in the PRC, Republic of China, it has Tibetan medicine, a Tibetan medicine hospital, also Western medicine hospital. So what happens is that Western biomedicine hospital only offers biomedicine, and they're famous for surgeries and acute solutions for accidents and so on. And Tibetan medicine hospital offers both. But the larger proportion is on Tibetan medicine solutions. So a lot of patients with chronic situations would go there instead, and they're both under the health insurance coverage. And it has been like that for the past 20 years at least, of my own memory, because I'm only touching my 30s, so that's how I can explain.
Yeah, thank you, and thank you to Wani for that, and thank you to Wani for connecting us as well. So, but that's what it is. It's about, you know, that bridge, and Western medicine has its place, very very much so, when for emergencies, but actually for chronic illness, and in many ways it's creating problems for itself by its dependence on pharmaceuticals for chronic illness. So, yeah, no, thank you so much. And I did ask you one question. So I've been asking people what would say, you know, their vision now that we haven't even touched on you being in Estonia, but in Western medicine, even in Eastern Europe, can you see Tibetan medicine or other forms of regenerative healthcare being introduced into the system?
I That's a very that's a very brave question. And I can't be too utopian. I also can't be too pessimist. I would say, realistically speaking, I do see that Tibetan medicine will grow better and better. It will eventually have a place in the medical field, but by 2035, I hope it's definitely not going to be like how it's presented as biomedicine, but there will be more healing centers, holistic healing centers of Tibetan medicine, Ayurvedic medicine, Chinese medicine, and other type of medicine, so people can have more choices. This for sure in 2035.
They will have their place.
Yes.
And how do people find you, Drukmo?
We have there is a website of my the organization that I work for, international Sorikang International, and also the Sorikang Estonia, where I work and reside, and my personal website. So we will offer those.
Thank you. And you also have a free gift to offer?
Yes, I will offer you the Medicine Buddha and Yutok Mantra from my second and third albums.
Thank you, thank you, thank you, thank you.
Thank you so much.
Well, I'm so grateful to have had the opportunity to chat with you, and also to learn a little bit about the use of mantra within Tibetan medicine, and look forward to connecting with you again. Thank you.